If your brain fog keeps hanging around, it's tempting to blame stress and move on. But persistent fog usually has a few specific drivers that get missed because they look normal on the surface. The goal here is to help you narrow down what's most likely, so you can talk about it clearly and test changes in a sensible order. Brain fog is not a diagnosis. It's a pattern: slower thinking, poor focus, low mental energy, and that cotton in the head feeling. The tricky part is that many causes don't feel dramatic. They're small daily inputs that add up. So we'll walk through overlooked categories: sleep quality, blood sugar swings, hydration and electrolytes, nutrient gaps, inflammation triggers, hormone and thyroid patterns, medication side effects, and even indoor air. Think of this like troubleshooting a system. You don't replace everything at once. You identify the most common failure points, then confirm with simple observations, and when appropriate, lab work with a clinician. Moving to slide 2. First, define your fog in a way that's useful. Is it slow processing, like your brain is buffering? Is it distractibility, where you can't stay on one task? Or is it memory, walking into a room and forgetting why? These patterns point to different levers. Also note timing. Fog that hits mid-morning can suggest sleep or blood sugar issues. Fog after meals can hint at glucose spikes, food sensitivities, or heavy digestion. Fog that peaks in the afternoon can be circadian rhythm, dehydration, or caffeine timing. And fog that's constant, from waking to bedtime, raises the odds of sleep-disordered breathing, thyroid issues, iron problems, medication effects, or chronic inflammation. One simple tool is a 2-week log. Track sleep length, wake quality, caffeine timing, meals, and the 0 to 10 intensity of fog. You're not trying to be perfect. You're trying to spot repeatable patterns you can verify. Moving to slide 3. Sleep is the most common overlooked cause because people judge it by hours, not quality. You can sleep 8 hours and still get poor oxygenation or fragmented deep sleep. 2 big flags are snoring and waking with a dry mouth or headache. That can suggest sleep-disordered breathing, which is strongly linked with daytime fatigue and brain fog. Another overlooked issue is inconsistent sleep timing. If your bedtime and wake time swing a lot, your circadian rhythm gets confused and attention suffers. Then there's light exposure. Bright light late at night can delay melatonin signals, while dim mornings can make you feel groggy longer. A practical step is to keep a stable wake time for 2 weeks, even on weekends, and see if your baseline clarity improves. If you suspect breathing issues, snoring, missed pauses, or unrefreshing sleep, bring it up with a clinician. It's one of the highest yield conversations you can have. Moving to slide 4. Another major driver is blood sugar volatility, especially if your fog feels like a crash. Some people feel sharp right after eating, then foggy, irritable, or sleepy 1 to 3 hours later. That can happen when a meal is heavy in refined carbs, light on protein, or missing fiber and healthy fats. It can also happen if you skip meals and then overcorrect with a big snack. You don't need a gadget to learn from this. Start by noticing, do you think better when meals are balanced and consistent? A simple experiment is to build one steady energy meal per day. Protein is the anchor. Add fiber-rich carbs and include a fat source. Then compare your focus window afterward. If you already have diagnosed diabetes, prediabetes, or reactive hypoglycemia symptoms, this is worth discussing with a clinician. The key idea is stability fuel. Moving to slide 5. Hydration is talked about a lot, but electrolytes are the part people miss. You can drink plenty of water and still feel foggy if sodium, potassium, and magnesium are out of balance, especially if you sweat a lot, eat very low carb, or drink large amounts of plain water quickly. The brain runs on electrical signaling. Electrolytes help maintain that signaling and blood volume. Low blood volume can reduce how awake you feel when you stand up or move around. A clue is frequent headaches, lightheadedness, muscle cramps, or feeling worse after lots of water. Another clue is very pale urine all day, which can suggest you're over-diluting. The goal isn't extreme intake. It's steady hydration paired with minerals from food, like leafy greens, legumes, dairy if tolerated, and mineral water. If you have kidney, heart, or blood pressure conditions, Ask a clinician before making big electrolyte changes. Moving to slide 6. Nutrient gaps can create fog in ways that feel like personality changes. Less drive, slower recall, more overwhelm. The most common ones to consider are iron status, vitamin B12, folate, and vitamin D. Iron is not just about anemia. Low ferritin, which reflects iron stores, can be associated with fatigue and poor concentration, even before hemoglobin drops. B12 and folate matter for nerve function and red blood cell production. Vitamin D is linked with mood and immune regulation, and low levels are common in people with limited sun exposure. The problem is, you can't reliably guess these from symptoms alone. If fog is persistent, it's reasonable to ask a clinician about checking labs rather than blindly supplementing. Also consider dietary patterns that raise risk: very low animal foods for B12, heavy tea or coffee with meals for iron absorption, or restrictive dieting overall. The win here is precision, not guessing. Moving to slide 7. Gut issues are another overlooked path to brain fog, not because the gut controls everything, but because digestion affects inflammation, nutrient absorption, and even sleep. If your fog tracks with bloating, reflux, constipation, or diarrhea, that's a useful clue. Some people notice fog after certain foods, but the pattern is rarely obvious. It can be dose-dependent or delayed by a day. Common suspects include high FODMAP foods for sensitive guts, lactose for those with intolerance, or large fatty meals that slow digestion. Another angle is chronic low-grade inflammation from gut irritation, which can make you feel mentally puffy and tired. The practical approach is structured, not chaotic. Instead of cutting 10 foods at once, pick one variable, like a consistent breakfast for 2 weeks, or work with a professional on an elimination and reintroduction plan. Also, persistent GI symptoms deserve medical evaluation to rule out conditions that need targeted care. Moving to slide 8. Chronic inflammation is a broad term, so let's make it practical. If you have brain fog, plus body aches, frequent infections, skin flares, or lingering sinus symptoms, inflammation may be part of your picture. One overlooked trigger is untreated allergies, especially indoor allergies like dust mites or mold sensitivity. Another is chronic mouth inflammation, like gum disease, which can quietly raise inflammatory signals. And then there's overtraining or under-recovering. Hard workouts without enough sleep and calories can push stress hormones up and leave you mentally flat. The point isn't to self-diagnose an autoimmune condition. It's to notice clusters of symptoms that suggest your immune system is on too often. A reasonable next step is to address basics first: sleep consistency, recovery days, and reducing obvious irritants in your environment. If symptoms are persistent or escalating, bring the full cluster to a clinician so they can decide what testing makes sense. Moving to slide 9. Hormones are another big bucket, and you don't need to be an expert to spot patterns. Thyroid function is a classic example. When thyroid output is low, people often describe slow thinking, low motivation, cold intolerance, constipation, and dry skin. But thyroid labs can be nuanced, and symptoms overlap with many other issues, so it's worth a clinician's interpretation. Sex hormones matter too. Some people notice predictable fog tied to their menstrual cycle, often around the late luteal phase or during heavy bleeding, when sleep and iron status can also shift. For men and women, chronic stress can alter cortisol rhythms, which can show up as wired at night and foggy in the morning. The key is pattern recognition. If your fog is cyclical, track it against sleep, cycle timing, and energy. Then you can have a much clearer medical conversation than, "I just feel off." Moving to slide 10. Medications and supplements can contribute to brain fog in ways that are easy to miss because the effect can be subtle or delayed. Some people feel foggier after starting an antihistamine, a sleep aid, certain pain medications, or medications that affect blood pressure. Others notice it after increasing a supplement dose, especially sedating ones. Interactions matter too. Even if each item is common, the combination can change alertness. The safest move is not to stop anything on your own, but to audit your list. Write down everything you take: prescriptions, over-the-counter products, and supplements, plus the time you take them. Then compare that timing to when fog is worst. If you see a match, bring it to your pharmacist or clinician and ask if cognitive side effects are possible and whether timing or alternatives exist. This is one of the most practical, high-signal steps because it's specific and testable. Moving to slide 11. Caffeine is another sneaky one because it can both help and worsen brain fog. If you use caffeine to push through poor sleep, you can end up in a loop. Caffeine delays sleep pressure, sleep quality drops, and the next day you need more. Timing matters. Caffeine late in the day can reduce deep sleep, even if you fall asleep easily. Dose matters too. Very high intake can increase anxiety, which feels like mental noise and poor concentration. And withdrawal can mimic fog, headache, low mood, slow thinking. A useful approach is to stabilize before you optimize. Keep caffeine at a consistent dose, take it earlier, and avoid stacking it with energy drinks or multiple strong coffees. If you want to reduce, do it gradually so you can separate withdrawal from your baseline fog. The goal isn't to demonize caffeine, it's to stop it from masking the real problem. Moving to slide 12. Your environment can absolutely affect cognition, and it's often ignored because it's not inside your body, at least not obviously. Indoor air quality is a big one. Poor ventilation can raise carbon dioxide levels, which some people experience as sleepiness and dull thinking. Mold and dampness can irritate airways and worsen sleep, which then worsens focus. Strong fragrances and cleaning chemicals can trigger headaches or pressure sensations in sensitive people. Another environmental factor is noise and constant interruptions. Even low-level background noise can fragment attention and make you feel foggy by the afternoon. The practical move is to run small tests. Air out a room daily, clean or replace HVAC filters, and keep humidity in a reasonable range. If you suspect dampness or mold, address the source, not just the smell. This category is powerful because once you change the environment, you don't have to rely on willpower. Moving to slide 13. Now let's talk about the when to escalate question. If brain fog is new, severe, or paired with red flags like fainting, chest pain, severe headaches, confusion, weakness, or major mood changes, seek urgent medical care. For persistent fog that's not an emergency, escalation means structured evaluation. Bring your 2-week log, bring your medication and supplement list, and bring a short symptom summary. What it feels like, when it happens, what makes it better or worse. Ask about a basic workup that often includes blood count, iron status, thyroid markers, B12, folate, vitamin D, glucose markers, and inflammation markers when appropriate. If sleep seems central, ask about screening for sleep apnea. If anxiety or depression is part of the picture, say that plainly, because mood and cognition are tightly linked, and support can be very effective. The goal is not to chase every rare condition, it's to rule out common, high-impact causes efficiently. Moving to slide 14. To wrap this up, here's the most useful mindset. Brain fog is usually a systems problem, not a motivation problem. Start with the highest yield basics: sleep quality, steady meals, hydration with adequate minerals, and consistent caffeine timing. Then, look at the overlooked categories: iron and B12 status, thyroid patterns, gut symptoms, inflammation clues, medication side effects, and indoor air. Change one thing at a time for long enough to learn from it, usually 1 to 2 weeks. If you try 5 changes at once, you'll never know what helped. And if your fog is persistent, bring your notes to a clinician so the conversation is efficient and specific. If you want more structured videos like this, subscribe, and for a quick check-in, comment with the pattern that fits you best. A. Fog after meals, or B. Fog from the moment you wake up. Aging is data. Your body responds to inputs.